All right. I think we're ready. Let's do this. Okay, it's on. Everybody's on here. Fingers crossed. This works. All right. Welcome everybody to our medical roundtable that we have today. We are super excited to have our medical advisor, Dr. Taylor Kuhn, on here with us today. So we have a really good deep dive with some really great questions on here today. But Taylor, before we start, I'd love for you to kind of introduce yourself. Tell us who you are, what you do, what your passion is, your favorite color,
and how you got into Rejuve.
Yeah. Oh, yeah. And add that too. So tell us, give us the 411.
Absolutely. Thank you all so much for having me. So my name is Taylor Kuhn. I'm a board certified clinical neuropsychologist. So I do assessments of people's cognitive and psychiatric functioning. I have a private practice and I run an interdisciplinary clinic in Santa Monica. And the clinic is actually spanned throughout California. I also am a research neuroscientist. I have a lab at UCLA. It's the neuropsychology, neuroimaging, and neuromodulation lab. And basically, that means we put energy into people's brains, predominantly using ultrasound, and look to see what that does by putting them into MRIs and testing their cognition and emotion. And then I do some industry consulting and some serial entrepreneurship in the medical software, medical device, and kind of regenerative medicine space. And it was that regenerative medicine work, stem cells and exosomes, that kind of thing, that led me to longevity. So I had done some longevity work in brain, including using MRI data of people's brains to predict not their chronological age, but their biological age of their brain. We built an AI model that did that very well, and then we demonstrated that chronic brain inflammation, such as in people living with HIV, augments that aging process and actually makes your brain, the biological age of your brain, older than your chronological age. And kind of in parallel to doing some of this brain-based longevity work, as I was developing my role in the regenerative medicine space, a real dear friend of mine from college, Gabriel Axel Montes, who's in the Singularity Net ecosystem and is the CEO of Pathform, he and I have stayed in touch for the last 20 years. He's doing some really fascinating work as well. And I told him that I had been signed up to be a beta tester for the early Rejuve app, and how much I was enjoying it and how much I loved the idea. And he and I riffed on it for a while. And then he was kind enough to offer to introduce me to Jasmine. And so I think we first met a little more than a year ago, maybe a year and a half. And I've been following Rejuve and just been so excited to get involved. And the timing has worked out really well, because the brain work that I do, including with ultrasound, and the regenerative medicine work I do, have kind of merged, in that it turns out ultrasound can help you put molecules into the brain better. And so we've been doing work using focused ultrasound to deliver exosomes to the brain, both for clinical diseases and also with the goal of extending life. So we've been doing some focused ultrasound delivery of exosomes to the brain for longevity research. So that's a long-winded introduction, but it's nice to meet everybody, and I'm excited to be here.
Awesome. Yeah, thanks for being here. As mentioned, Taylor's been kind of one of our original beta testers for a long time. So ever since beginning, even before the redesign and everything. So super cool to have him more involved. And actually, that was some interesting stuff that you were talking about. I mean, it's not exactly the subject matter of the AMA at the moment, at least from the questions that we had, but maybe there'll be some time to get into, or maybe, as you answer these, you can apply a little of that experience to that as well, because that is actually something that relates to a concept that I've been developing a bit. But anyways, so we're going to get into the AMA questions that were submitted by the community. And actually, these are really good. And yeah, a lot of them do kind of intersect between longevity and overall mental health and all that. So pretty cool. So the first one is, can you fix brain fog? Very broad question.
Yeah, so it depends on what's causing the brain fog. You know, I hear people clinically talk about brain fog often after a concussion. And so one of the things that can fix brain fog is time. I also have kids, and so I've experienced the chronic effects of sleep deprivation that can definitely cause brain fog. So I think the first thing is, can you get further out in time from the injury, or can you get further out from the environmental cause of it, like chronic sleep deprivation? I think the other thing is, you know, we know that low impact cardio and quality sleep are two of the most successful ways to improve brain health and cognitive function. Cardiovascular health is paramount to brain health. The brain brings blood to the brain. Sorry, the heart brings blood to the brain, which brings oxygen and nutrients. So for the brain to function, you need a healthy heart. There's actually this interesting thing called neurovascular coupling, which is the ability of brain cells to be coupled to vasculature and pull extra blood and therefore extra oxygen and nutrients on demand as they need. And you see things like neurovascular coupling fall off in degenerative diseases like Alzheimer's disease. Similarly, I think that this professor named Nedergaard is going to win a Nobel Prize for finding out that there's this system in our brain called the glymphatic system, like lymphatic but with a G. And it turns out that when we're in slow wave sleep at night, the space between our brain cells opens, and there's kind of this washing out of debris throughout the day. To use that chronic sleep deprivation example again, my head would feel heavy and I would have this fog, and it was harder to work. And it turns out my brain doesn't actually weigh more, but it is kind of gunked up with detritus and you know, used waste and misfolded proteins and all sorts of other things that my brain didn't have the opportunity to wash out in slow wave sleep, which is something else that we see in degenerative diseases, Alzheimer's in particular. There's a sleep disruption, so that slow wave sleep isn't as long or as high quality, so the glymphatic system's ability to clear things out isn't as good. You can kind of think about it like a heart, right? You got these pipes going to your heart, and if they build up with plaque, they don't work as well. And if there was a system to kind of clean that out, but that system broke, the plaque would keep building up, and that's part of the idea behind degenerative diseases. So yeah, sleeping well, eating well, keeping your heart healthy. And then I've become kind of a fan of, I think of myself as a transhumanist, and I used to always think of that in terms of like, you know, prehensile tail and brain-computer interfaces. But I've realized through the regenerative medicine space that there's all sorts of biological transhumanism things too. So like, I really dig peptides. I think NAD is a really powerful peptide. For me, it's the equivalent of being in the ketogenic diet, where because I'm not burning glucose and insulin and not getting tired after I eat it, just have this nice clean energy and mild euphoria all day. I have the same experience with NAD. So, you know, vitamins and things like that. So I think, again, the underlying reason is important, but I hope that's helpful.
Yeah, that's like.
I feel like this is. I was gonna say, I feel like this is something that all of us, especially as parents, and maybe particularly moms, are like always struggle with. Where I'm like, I just feel like I have so many things in my brain right now that I don't actually remember anything. It's just kind of like fuzzy. So, which I think actually is kind of pulls into the next question that we had in there, which I saw it and I was like, hey, this is exactly how I feel, which is essentially like, why can I remember all the lyrics to Backstreet Boys song from 1999, but I cannot remember what I walked into the next room for, what I had for dinner last night, things like that. How does that happen? And can you fix it, or is it just kind of a thing?
Absolutely. So the one thing I want to change is it's actually not the same cognitive process, right? So being able to retrieve a memory that you created a long time ago is very different than holding information in mind in the moment. So memory is like a filing cabinet. You've got to put the information in, you've got to close the cabinet and keep it in so that when you open it back up, it's still there. And then you have to be able to find it and take it back out, right? And it's that retrieval part that's what's happening when you know, that song pops up. I thought the movie Inside Out did a great job of making fun of that experience that we all have. And part of the reason that those things stick with us so much is that they're musical. The reason people with PTSD have flashbacks is there's this thing called the emotional enhancement of memory. So when you're really, really scared, that heightened anxiety, that heightened fear enhances the memory and makes it easier for it to come back. If you think about a memory like a building, the more streets that lead to that building, the easier it is to get back. And so we call those cues. We all know that smell is a really strong cue for memory. Emotions really are also. And music taps into this really, really broad, diverse network of the brain. So it becomes this kind of magical cue, which is the same reason that you can see those videos online of people with Alzheimer's disease who, when you play music that was salient for them, emotionally meaningful for them earlier in their life, it almost has this rejuvenating quality because you're bringing in emotion, you're bringing in this kind of multimodal language network. So anyway, that's a retrieval process. Just like if I asked you, what are the name of your 4 kids? You have to pull that information out. And people who have Alzheimer's disease can't do that because it's like there's no bottom to the filing cabinet. The information's not in there. But for most of us in our day-to-day, the information is in there. We're just struggling to retrieve it. That memory retrieval is one of the most common healthy aging difficulties. We tend to slow down cognitively. We don't process information as quickly. And we retrieve things more slowly, but with time or cues, we get it. It'll come to us, which is how you know it's still in the filing cabinet. It's just harder to get back. I want to separate that from what's called working memory. And that's the ability to hold information in mind and do something with it. So if I read a bunch of numbers to you and asked you to read them back to me, that would be attention. Do you have an attention span as long as the numbers I give you? Most people have an attention span of 7. It's not a coincidence that, at least in the United States, telephone numbers tend to be 7 digits long. But if I read you a series of numbers and then asked you to, for example, say them backwards, or maybe even more difficult, say them in order from lowest to highest, you'd have to hold those numbers in your mind and then move them around to reorganize them. That's called working memory. Different brain network, different cognitive function. And that's what you're using when you go to the next room to get something and then forget what you went into that room for. You're actually not forgetting, you're dropping that information out of your working memory. Almost certainly because your attention pivoted, right? So like if you're messing with these numbers, trying to put them in order, and then there's a firework outside or somebody asks you an important question, hey mom, I need something. Like you're going to shift your attention, and in that shifting, those numbers will drop. So in the walk from one room to another, your mind moved elsewhere, and you dropped from your working memory what you were trying to go to the room for. There's 2 main ways to work on that. One is what we call external aids. So things like lists, notes, calendars, things technology has really helped us kind of offboard. And there are even a whole bunch of cognitive structuring strategies. There's a clinical space called cognitive rehabilitation. It's not cognitive behavioral therapy like psychotherapy. It actually came out of the stroke world. And it's somebody lost this cognitive skill. How can we use the skills they still have to help them bolster against that weakness? And so there's some executive skills training that you can do, but a lot of that has to do with just kind of organizing your space in a very routine way, doing things very kind of religiously in the same way. That idea of like everything has a place and one place for everything. Because then when you can't find your keys, there's only one place to put it, right? So you can do these external things to change. And the other, and I think I get kind of mixed faces when I say this, but I want to be very clear. I mean a specific kind of mindfulness meditation. There's a specific kind of meditative practice that is by default attention training. And some people have you stare at a candle, some people have you focus on the breath, but the practice is trying to keep your attention on that thing for as long as possible, knowing you're going to fail. Your mind will drift either to thoughts or feelings. And then the practice is to just notice that it's happened, and then either say thought if it was a thought, or feeling if it was a feeling, and then shift your attention back to the candle or the breath. And then to keep doing that. And what happens over time as you practice is that your attention stays focused on the candle, your breath longer. The amount of time it takes you to notice that you've drifted gets shorter, and you're able to pivot back faster. It's literally a form of attention training, and it's what many of us, myself included, learned when we were kids reading books. And you're like, how did I turn the page 5 times? And I have no idea. And then they teach you the exact same practice, and then all of a sudden you got 3 pages before you realized you hadn't read anything, and then you got 1 page, and you read, and as the number of pages you kind of drifted for got shorter, you read 3 pages before you drifted, and then 5, and then 10. It's the exact same practice. And so those kinds of things, you can actually learn to train your attention better.
That's like incredibly deep explanation for that. And, it's awesome. I mean, I feel like even with the, like you mentioned with writing things, sometimes, write down things and not even necessarily go back and read it, but it's like somehow it makes you remember it, just that action of, associating it with something else, like doing an extra action on top of it to sort of etch it into your mind, or however that works.
There's actually a very specific pathway between handwriting and memory. I learned it anecdotally in college. I took 1 semester where I tried to type my notes and I didn't learn a damn thing. So I went back to handwriting them and I learned and remembered much better. And then in graduate school, we learned about kind of the brain networks that allow that to happen. And it's again that same idea that you're laying down multiple pathways back to the information.
Mm-hmm.
That's so interesting, because I am also that person that while in college I had to handwrite all of my notes, because something about just like typing it out is like you don't think about it at all. I don't know what it is, but but I had, and it's the same thing with the calendar for me. Like I do have a calendar on my phone that I access regularly, but if I need to like plan out my day based off of tasks and things like that, I have to write it down on paper, because looking at it on my computer just doesn't hit the same. So weird. I feel like you're answering all my questions that I had. I just was going to add in a little point, because I feel like, especially with the invention of social media, particularly TikTok and Reels, like our attention span for stuff is so short, myself included. If a video is too long, I'm going to swipe past it immediately. I'm going to fast forward it 2 times speed, and I'm going to be like, no, you're talking too slow. I need to watch it. So I probably should use these exercises to gain my attention span a little bit longer, now that it has been shortened from social media. So we should all maybe take that into account.
Yeah, there's actually a similar question here that is not so much about attention, but it's how to improve memory and speed of thinking. So I thought that was kind of interesting, of because I think you did allude to it a little bit in the beginning, of like how fast the recall actually is, and that kind of I don't know what you would call it, like cognitive fitness, to be able to retrieve that information, and lots of it reliably.
Yeah, I think especially in the context of like all of the technology that we have for health and brain and longevity, it's a really underwhelming answer. But the number one correlate to how fast you process information is heart health, is cardiovascular health. So everything that you can do to keep your cerebrovascular system healthy will make you faster, and keep you faster longer. Even if you have dementia, like Alzheimer's disease, if you can keep your heart health, like low impact cardio, you'll actually slow the decline of the disease. And so I think, again, as underwhelming as that is, that's part of it. I think that with regards to like retrieving information, stuff that you really, really want to like make sure you can get back to, there are certain kinds of techniques, for example, errorless without error learning, which is a technique whereby you like kind of repeat and rehearse information and then purposely give yourself multiple ways back to it. I am awful at names. So if I really, really, really want to remember someone's name, I will like draw an image of their face in my head. I'll write the name in my head all the way around it. I'll try to come up with some kind of mnemonic that links that person to the name. In my phone, so tons of people in my phone are like Jasmine Rejuve, Stephen Fish Store, or wherever I met them. Give yourself all those different ways to get back to that information, and then making sure as you rehearse it that all of it's correct. And in doing so, you've given yourself a whole bunch of ways back to it. Another example is you could think about something that's emotionally meaningful to you that you can associate with it, because again, emotion is a really strong cue for memory. But where like day-to-day retrieval is concerned, I honestly don't have a real strong answer for that. I think things like, again, NAD has been really helpful for me. You can play with different vitamins and nootropics and peptides. And to be clear, I don't work for any of these companies. It's been a thing I've been really enjoying experimenting with. But I think also, there's this thing we do, particularly as we get older, where the same cognitive mistakes we've always been making, we start to attribute more anxiety and worry about. And so, I have trouble recalling things sometimes. I'm 36. I guarantee when I'm 76, I'll still have trouble recalling things, and hopefully it won't be a whole lot worse. But trying to pay attention to how much emotional weight I'm anchoring on that is important, because anxiety and depression both undercut and worsen cognitive performance, both from a brain perspective. People with chronic depression, for example, get less blood flow to their frontal cortex. That's the part of your brain you want functioning the highest, because it's doing all the executive functions, where there's things the executives do: pay attention, plan, organize, multitask, problem solving, decision making, just little things like that. And so things like chronic depression, chronic inflammation, anxiety can undercut your utility of the frontal lobe. And so also we're doing things that will improve mental health, will improve cognitive functions. To say one last thing on that, I worked at the VA for a couple of years, four maybe. And the very common neuropsych case that I would see was a soldier who'd been in, OEF, OIF, Iraq, Afghanistan, and they'd been near an IED, a bomb exploding. And they couldn't pay attention, they couldn't remember things. And so they thought that they had a traumatic brain injury from the explosion. And unfortunately, sometimes that's very true. But it was also very common to see people whose brains, when you put them in an MRI, look normal, whose cognitive function in a quiet room where I'm testing them is actually great. It's exceptional. They have the capacity to pay attention and remember. But despite having the capacity, when they're out in the world, their PTSD is undercutting their ability to use that capacity. Perhaps because they're hypervigilant, looking for a threat, so they're pivoting their attention constantly to scan their environment, which makes it really hard to pay attention and remember what the person across from you is saying. So just as an example of how an anxiety disorder like PTSD can take the capacity you have and undercut your ability to use it. So I think another thing is really working on improving mental well-being.
Okay, so this is like a bit of I'm going to throw like a wild card out there, but it's a bit related to these things. And, clearly speaking from what scientific and clinical perspective, what about things like microdosing, right? Like, does that actually like grow new neural connections and improve cognitive function? And then also, just the scene on psychedelics in general. No one wrote it there, but I wrote it in. So there we go.
Yeah, I think it's a fascinating space. I'm personally and professionally interested. I had the privilege of going to the Psychedelic Science Conference that MAPS hosted in Denver last year. So I want to make two big caveats, and then I'll dive into the really fun stuff. The first caveat is underlying mental health conditions need to be taken seriously, as well as underlying heart conditions where psychedelics are concerned. They are often safe, but just like anything else, they aren't always. And people who have family or personal histories of things like bipolar disorder or psychosis are at increased risk of things like substance-induced psychosis. To say differently, like a really bad trip, perhaps a really bad trip that leads to severe mental illness. So I just want to put that caveat out there. The other is the word neuroplastic gets used all the time. And I'd like to dispel two myths. One, we don't just use 10% of our brain. If we did, we'd be dead. We're always using most of it, although a lot of it is inhibitory, right? So for example, to reach out and touch the screen, I have to not do any of these other things that I can do. I have to inhibit every option except this one. That's what Parkinson's disease gets in the way of. You can't inhibit all the other options. So in order to say these words, I have to not say the other ones. So there is a lot of inhibition going on in the brain, but it's not just 10%. And in the same way, we actually only recently learned, although I think a lot of us assumed it, that the brain continues to be neuroplastic or making new neurons as we get older. So our brain continues to make new neurons throughout the life. That's great. One of the main places that happens is the hippocampus, which is where we make new memories. That's the area first affected by Alzheimer's disease. So it's awesome that that's true. But neuroplastic can mean so many things. Like just having this conversation, if you learn something or if you're, multitasking and looking somewhere else and you have a neat experience, like that's changing the wiring of your brain. They've shown that psychotherapy changes the wiring of your brain. So I think, yes, psychedelics almost certainly do that, but I don't know that they do it in a way that it is necessarily different or more profound, with one really important exception. There's been some really neat MRI research out of particularly London or the UK. And part of what they've shown is that the frontal lobe, which does a lot of the inhibition, not all of it, but a lot of inhibition, or kind of, let's say you've got 6 kids. the parent keeping them in line is the frontal lobe. And one of the things that happens during some psychedelics like psilocybin and I believe LSD is that the ability of the parent to tell the kids to quiet down gets weakened. The frontal lobe kind of functionally, not structurally, the connections, the wires are still there, but the function of its connection to other places quiets. And that allows for all sorts of really cool things to happen, including generative and creative thinking, the ability to make all sorts of new meaning out of things that you may not have been able to do before, hallucinations, including synesthesia, which is this kind of the cross wiring of different senses where you might taste colors or feel sounds beating against you like a waterfall. And so all of that can become what mystics might call like a colossal cosmic consciousness moment. It becomes this peak experience from which you can do so much with. And I think that what we really know about this, like one of the main things we know is that although a psychedelic trip can be rad, it's really whether or not it makes a difference in your day-to-day life thereafter is about whether or not you do integration work. Can you bring that experience back into your day-to-day life? And I think that part, humans and our brains both are functionally meaning makers. So what is the meaning that you make out of this experience? And what can you do to shift how you think, how you feel, how you live your life based on that? And that's all kind of the experiential piece. I think we also know very fundamentally that, just as an example, ketamine can treat depression. Whether in the early days, they were doing it at an anesthetic dose. So you were not really cognizant or conscious, and it still had an antidepressant effect. I think we're learning that psilocybin does as well, although probably through a very different mechanism. And then there's ibogaine, which I don't understand but find fascinating. The idea that there could be this kind of grandfather heavy, sometimes very dark psychedelic experience that has the ability to very rapidly detox you from opiates is profound and fascinating. And I'm very happy to know that there are several companies around the world working on that. I think where daily microdosing is concerned, I've seen mixed reviews in the literature about whether it actually makes like your thinking faster or your multitasking better. But I know a lot of anecdotal research, including anecdotal information, including stuff we've read online, that people enjoy it and that it can make their experience better. And I think in that case, at the very least, it's improving mental health in the moment. It's probably helping things like attention or shifting some of the negative emotional experiences people often bring to work, allowing them to be more engaged. But again, it's very, very person specific.
Cool. Thanks for going into that. Actually, I spoke at a Psychedelics and Longevity conference last year, which was an interesting thing to even emerge. It was Wonderland. So yeah, I think those, and even at this previous conference that we attended in Amsterdam called Health Europe, which was all about just healthcare in general, all different verticals, they did have a track about psychedelics. So I think it is something that is actually gaining legitimacy, which is pretty exciting.
Agreed. The idea that we can have all of these drugs which started medicinally and then became drugs of abuse, and that's somehow okay. But drugs that cultures have been using forever for things like religious, spiritual, and enjoyment can't also have a health side is ridiculous. So I'm glad that it's getting the airtime and the research that it deserves.
I think that you just hit Jasmine's personal passion project like right on the nose there. Since she has lots of strong feelings about, holistic medicine and our lack of usage, especially in the Western world and such. So,
well, if I could add one other thing, something interesting that psychedelics have to offer us is you don't only have neurons in your brain. There are a ton of them in your gut. Chinese, for example, were very right for the last 3,000 or 5,000 years when they called the gut the second brain. There are neurons in your heart. So the ability to use a drug like psychedelics to shift kind of some of what's happening systemically, I think is really, really interesting. And, for example, there are some pretty significant diseases that start in the gut that affect the brain. There's something called PANDAS or PANAS, both of which are like childhood psychiatric syndromes that start with kind of microbiome dysregulation. Anecdotally, I had a colleague whose daughter had started saving her fingernail clippings and her hair in plastic bags. And she was like, where did this come from? So she took her to a pediatric psychiatrist. psychiatrist very astutely asked if she'd been having any GI issues, which the child had. And so the psychiatrist's recommendation was, open her mouth, throw probiotics at her twice a day and see what happens. And in less than a week, it had totally resolved. And there's also other things we know, for example, that not necessarily for everyone, but for many people, Parkinson's disease starts in the gut. There's this really interesting study of people who had had their vagus nerve cut. I honestly don't remember why, but they had colonoscopy samples from all these people, and they tracked them over time, and some of them went on to develop Parkinson's disease. And what they found was that there were some people who had the same pathology that would develop Parkinson's disease, and you could see it in the data in the samples from their colonoscopy, but it hadn't been able to travel to their brain via the vagus nerve. So there's a whole lot going on in the gut relative to mental health and cognitive health that's super, super important. And so using something like psychedelics or holistic medicine to treat not just the brain, but the whole body, I think is so apropos. And I'll say one last thing on that. I think that's why no one solved Alzheimer's disease yet. Everyone's aiming for a single drug for a single cause. I think one of the big drug companies spent $20 billion on Alzheimer's disease and then closed their neurology department. And I think the problem was they were going after like one of the things that's related to the disease. But as we've already talked about, there's neurovascular coupling difficulties where the brain can't get the blood it needs. Slow wave sleep is disrupted, so it can't clear out the plaque as well. There's probably at least 8 things going on that lead to Alzheimer's disease. And no, I don't personally believe that any single pill will ever be able to solve such a holistic or multifactorial problem. I do think we'll get there to solving the disease, but I think it needs to be by a multifactorial, more holistic approach.
Taylor, you segued exactly into our next question with the gut health. We have a couple from the live stream that I'm going to ask after this, but since we were talking about gut health, I wanted to bring that in. Like, how does that affect your brain? Does it affect brain fog? I mean, TikTok has told me that those things are somewhat correlated. Is that true? Is it not true? And or dive into it more, I guess, is my question.
Yeah, you broke up just a little bit. Just want to make sure I heard correctly. How does gut health relate to brain fog?
Yeah. Yeah. Or brain health in general. Are they related? Or you kind of touched on that a little bit, but I'd love to hear a little bit more.
Yeah, I think it's really important to always acknowledge when I don't know things. So this is a space I know a little bit less about. The examples of pandas, so a gut-based psychiatric issue, or Parkinson's being a disease that, at least for some people, starts in the gut. So there certainly is not a zero correlation between stomach and brain, right? They are related. I think that I would say probably 7 to 8 months out of the year, maybe depends on the year, 7 to 10 months out of the year, I eat carbs. And if I eat, I had pizza for breakfast, I got a little sleepy afterwards. I'm not thinking as well when I'm a little sleepy. But and that's because when you eat carbs, it gets burned into glucose for fuel, and then your body produces insulin to balance that out. So you have this kind of wave happen. And that one of the things that can cause is fatigue. Whereas I mentioned this before, the other couple months out of the year, I don't eat carbs and I'm in ketosis. So instead of burning carbs for sugar and energy, I'm burning fat for ketones and energy. And because of the way that works, you don't cycle. And again, I'm not recommending this. Everyone's different. But for me, I noticed that I just kind of clean cognitively throughout the day, in part because I'm not going through this digestive related fluctuation in glucose and insulin. So again, there's not zero correlation. I think that the way we eat, how often we eat, whether we're in a caloric deficit or a caloric surplus, is really important. Again, I think it's important to pay attention to cultures that have been around for millennia. Fasting, whether you're doing intermittent fasting or the occasional 24 hour to 1 week fast, fasting has some pro-cognitive effects. The longer ones are in part because you shift to ketosis, but there's other things at play as well. And I think also, if you think about so much of what's happening in the digestive system, gut, is the removal of toxins, the removal of things you don't want from the food, from the drink, and then from your body. That giving and I want to be very clear. There's all sorts of crazy cleanses. I know nothing about them. That's not what I mean. Although maybe they're great. I have no opinion on them. But giving your digestive system an opportunity to work less hard, and therefore your body to reallocate resources elsewhere periodically, I think can be really helpful too. I'm also sure there's a ton of literature about this I don't know. So, but I think that yes, there's a strong relationship there.
And that's so interesting. I feel like, I mean, gut health is something that I particularly am passionate about, mainly because I have an autoimmune disease. So anything that I'm like, oh, how can I fix this? Or how does this impact the rest of my life? I can always tell, like because I have celiacs, for example, I can always tell when I get glutened because it definitely makes me feel like I'm moving in slow motion. And I'm like, I don't know if I actually am, but I feel like my brain actually is. And the brain fog comes with that. So I'm always like, how do I fix this? What's the takeaway here?
Well, I'm really glad you gave that example, because I think I got stuck a little bit on thinking kind of broadly, but part of what's happening there, which we know it happens in all sorts of diseases, and I'll give 2 examples, is that part of what's happening isn't just what you ate and kind of the negative reaction your body's having to it. It's the inflammation. It's that inflammatory response. If I hit my thumb with a hammer and I have an inflammatory response that's acute and it goes away shortly, that's super, super healthy. But if I hit my thumb with a hammer and the inflammation never stops, it's going to cause serious, serious problems. And so for people with autoimmune diseases, or for people who have a super intense inflammatory response, you can actually have this kind of cascade of all of these different things that happen in the brain that makes cognitive function worse. And that's especially true for people living with chronic neuroinflammation. I gave the example of people living with HIV before. HIV crosses the blood-brain barrier very quickly, gets into the brain, and causes a chronic inflammatory state in the brain, which worsens cognitive function, at least augments, if not accelerates, brain aging, and in some cases can lead to an HIV-associated dementia. Another example is, I want to make sure I get this right. I believe I have this order right. Chronic PTSD, so again, a psychiatric symptom or psychiatric syndrome. Chronic PTSD can in some cases cause a long-standing inflammatory response in the brain, and then that inflammatory response can lead to depression. So you can have a brain inflammation situation caused by mental health difficulty that can lead to another mental health difficulty. So you can see how that cascade happens. Or you can have a chronic neuroinflammation caused by a disease that can lead to cognitive deterioration and dementia. So that inflammatory component is super, super important. I think there's a lot of things we can do systemically to reduce inflammation, ranging from some of the very boring things I've said already, like low impact cardio and good sleep and heart health, to a host of medications you can talk to your doctor about.
I love it. Okay, we have a question from, or one of the questions from the live stream kind of goes along with this, but it was talking about how quitting smoking, or they've heard that quitting smoking helps protect the brain. Kind of goes along with gut health too. So true or false?
True. Any kind of smoking affects the lungs, therefore weakening the lungs, therefore making your cardiovascular system worse. So that's the simplest, shortest answer. If you make a healthy change to make cardiovascular health better, then you're going to make brain function better. I also don't exactly know, you can smoke a lot of things. So they've shown that people who chronically use certain drugs have reduced blood flow to the brain. And that as you abstain from those drugs, that blood flow comes back to normal. However, that's not necessarily true of nicotine. If we could get nicotine into our body in a way that wasn't carcinogenic, so it didn't cause cancer and didn't hurt your lungs, it's actually a drug our bodies quite like, including it can enhance cognitive functions. Actually, the first NAD, the first word is nicotinamide. We have all sorts of nicotine receptors, including in our muscles. So that kind of molecule our bodies really like, but unfortunately the ways we get it into our bodies are pretty damaging.
Interesting.
Yes,
okay, I did not actually know that about NAD. So that's a fun fact that I'm taking away from this. Go ahead, Jasmine. I interrupted you.
Yeah, I was just like, I kind of forget about this sometimes, that, when it says that like nicotine prefix, on some of the things that's actually referring to that molecule, it's like, it's kind of crazy. Like we know we have the cannabinoid ones as well. So it's, kind of along similar lines.
Well, if you think it's cool when you think about the two different kinds of muscles, right? You've got nicotinic or muscle receptors. You have nicotinic and muscarinic. And to go back to the psychedelic example, muscarine, right, is Amanita muscarina. Those are the mushrooms that Super Mario Brothers made really popular, right? The red ones with the white spots. They're the ones that reindeers eat that makes their urine psychedelic, and they're the ones that the Viking berserkers ate before they went into battle. And part of the reason they did that was muscarinic receptors, like, it really engages the parasympathetic and sympathetic nervous system and kind of turns you into that fight-flight mode and engages your muscles in a way that I think we might often think steroids do, although it's different. So that they became the berserkers through muscarinic mushroom trips.
And I guess they probably went to Valhalla afterwards, right?
I'm sure.
All right. So I guess we should probably talk a little bit about some AI and those types of things. We had a couple of questions along those lines. So I guess we can start with, can AI help in diagnosing neurodegenerative diseases? I guess that's it currently.
Yeah, 100%. And I've published some papers on this. A lot of other people have too. I'll give a basic example. So I've talked about MRI a lot, right? MRIs are a big magnet that lets you take pictures and videos of people's brains. And people routinely get them, and then a radiologist looks at them, right? So you have human eyes looking at pictures, trying to see what they think. Does this look too big? Does this look too small? Is there a bleed? And don't get me wrong, radiologists are amazing. However, I think we have kind of all aware that we live in a world where computers tend to make less mistakes or fewer mistakes than humans do. So whether it's brain imaging or cancer screening, there's been some really good research on, rather than having a human look and go, that's too big or too small, you can actually have a machine look and statistically compare the size of, for example, my hippocampus to that of other men my age and education, which you can do statistically already. But then you could take the volume of different parts of my brain, the amount of blood flow to different parts of my brain, the structural connections from different parts of my brain, and the functional connections from different parts of my brain, all of which you can get in a 45 to 60 minute MRI. AI can actually take all of that, put it together, and predict whether or not you have dementia. We published a paper doing that, showing that with above 90% sensitivity and specificity, by combining those different modalities of brain image, not only could we differentiate healthy older adults from those who had dementia, we could also differentiate dementia subtypes. So we could say, are you healthy? Do you have Alzheimer's disease? Or do you have Parkinson's disease with dementia? So that's just an example of how we can use AI for a diagnosis. I think we can also, there's some really cool papers showing that you can use someone's functional connectivity. So how the different parts of the brain are functionally connected, right? If I put my hand up, some of you might also, some of you didn't, and some of you might have done this. Those of us who put our hands up are connected. Those of us who did nothing, we aren't. Everybody who did this when I did this, we're anti-connected, right? So that's how the brain works. Some things are connected, some things aren't. Some things turn up when other things turn down. And you can actually predict which drug in some cases or which psychotherapeutic styles people will benefit from best from based on their brain metrics. So I think you could amass this data set of MRI, cognitive function, and emotional function, depression, anxiety, and start applying AI algorithms to say, does this person have a disease? If so, what medication or treatment regimen might they benefit best from? How might that need to change over time? And I met this really fascinating cat who was finishing his PhD in health economics. I think he was in Denmark. But he was training a model very much like ChatGPT, but instead of training it to predict what the next word will be to make a sentence, he was training it to predict what the future diagnosis will be based on what someone's demographics and past diagnoses are. So you can not only imagine a world where we can diagnose somebody really well and then predict what treatment they need, but as a medical community, we have to shift from, oh shit, someone's sick, let's fix them, to how do we prevent this? And that's a huge part of how we're going to be successful with longevity, is by being preventative rather than curative. And so with a model like this, you could say, all right, for people roughly with these demographics, what are the most common 5 reasons they go to an ER? Okay, if they go to an ER and have this diagnosis, what's the most likely thing that'll happen next? Okay, well, now we treat for that next thing when they come into the ER, and we prevented that from happening. not only helping that person be healthy longer, but also preventing them from coming back to the ER and therefore reducing the burden to the healthcare system, making that healthcare system stronger and better for everyone. So I think there's a whole bunch of really fascinating ways we're going to get to do this, and it feels very, I don't know if this is the best word, but like now the times feel pregnant with so much about to come, and I think it's super exciting.
Yeah.
I think that's the takeaway that we have from like every podcast that we record with anyone, any conversation that we have, is that we have to see this shift to preventative medicine rather than reactive. And then I think that our overall health as a society will get so much better when we are actively working to take care of ourselves rather than have something happen and then decide. I think it's one of those things that you realize, like, you don't realize how good your body is until you injure it when you're working out, say, and you're like, oh, now I can't run for 6 weeks. I hurt my ankle or whatnot. And then you're like, oh, maybe I should stretch better because this happened because I didn't stretch enough or whatever the case is. Like, you start taking care of it afterwards. And that shift as a society is a hard one to make, but I think it's so beneficial. Hopefully in the next few years, we'll see that happen.
I think so too. I tell patients this example often, like, it's really easy to be on a downward spiral. An example is like you have a concussion, your brain isn't functioning quite the way you want it to, so you get anxious about it, and then your anxiety makes it worse, and then actually your brain recovers, but you're still feeling anxious, and then you're extra hypercritical of the mistakes you do make, which makes you more anxious, and you've got to have this downward spiral. And I think that the reactive is better than curative. The reactive healthcare system does that too. Oh, there's an issue, treat it this way. Oh, that treatment caused this, treat it that way. And you end up on this downward spiral, not necessarily as an individual, but I think it's kind of a healthy community. Whereas preventative healthcare says, oh, how do we prevent this from happening? Oh, good, that didn't happen. That allows you now to be more healthy and to do this other thing. And then you build this upward spiral. Like, there are a lot of days that I want a pizza and a beer, but then I go play basketball and all I want is like a gallon of water and a salad. So that healthy activity begot health, begot a better diet, begot more activity. So it becomes this upward spiral.
And I don't know if it's just like maybe my immersion in the space, but it does seem like the sentiment is changing, and at very least within, the actual healthcare kind of scene. Like, I'm seeing more actual physicians saying these things and supporting these efforts of preventative medicine and, holistic wellness and everything. It's become, it's not like no one really gets too distraught or anything when you say it. It's kind of just becoming a thing that, all right, we've finally came to that point of, like, kind of when people like have to admit an addiction or something, it's like we admit that this is a serious problem and that we've screwed up royally. Now, what are we going to do to reverse this whole entire trajectory and change the system so that we can actually focus on wellness and longevity and being healthy into our advanced years and seeing, the fruits of all of these cool technologies that are coming about.
Couldn't agree with you more.
Oh my gosh, we're already at like 50 minutes here. So we're gonna have to wrap this up, even though I feel like we got through maybe a third of the questions that we had on here. So maybe we'll have to have a secondary one about this. There was a couple, I guess, questions about like concussions or falling and hitting your head and how that impacts your brain long term. So I maybe want to touch on that really quick, and then Jasmine can add like our final question on here before we wrap up. So I think the question was, does falling and hitting one's head on several occasions over the past 15 years affect your life expectancy?
Yeah, absolutely. So just hitting your head isn't a concussion. To have a concussion, you have to either have lost consciousness for more than a split second, but less than 30 minutes, or had an alteration of consciousness, so dazed, confused, nauseous, dizzy, vomiting, and then maybe like have a spotty memory for around it, the time of the injury. You don't have to have all of that. If you hit your head, felt confused, and threw up, it was a concussion. But we call the concussion is equivalent to a mild traumatic brain injury, MTBI, and we know that cognitively you should be healthy at the 3 to 12 months at worst. If you're not, after that, it's no longer brain-based, and it's probably difficulty with regulating your autonomic nervous system, which can be easily fixed, but a lot of people don't know that that's the issue. If you have a moderate or severe traumatic brain injury, which basically by definition, you have to have been unconscious for quite a while, you probably don't remember some part of the day that you had the injury, if not more, and most importantly, a CT or an MRI showed damage to your brain, right? A bleed, a contusion, something like that. Having moderate to severe TBIs, or particularly more than one of them, in the research, it shows that that can reduce life expectancy. Depending who you read, having like a moderate to severe TBI can reduce life expectancy between 5 and 9 years. But there's a huge asterisk. That's an average over a group. The groups aren't very there's so much heterogeneity or diversity in the groups that they're studying, which means that there are some people who had no change in life, and many of them who died early that probably didn't have anything to do with their traumatic brain injury. So, but I think it's not a hard leap of logic to say if something damaged your brain, it may reduce lifespan. But again, that's something you can see on an MRI. Having a concussion or having a couple of concussions is very, very unlikely to reduce your lifespan.
That's good. That's what we want to hear.
Yeah, we definitely don't want to, tell anyone that they're, going to die sooner because they hit their head and things of that nature. And of course,
that's certainly different, by the way, from people who are like lifetime fighters, lifetime football, lifetime rugby players. It's a very, very different conversation. I don't want to minimize their experiences or the real brain issues that they can have. But for most of us, walking around getting a concussion or 3, don't worry about it. But if you are having long-term cognitive effects, look up something called autonomic dysregulation. And one of the best things you can do is train yourself to exhale longer than you inhale. I know it sounds silly, but it'll fix it.
Interesting. So there was one on here that's kind of one of those general things, but I think is valuable and also synergistic. What's the one habit that young people should drop now to promote brain health when they're older? Maybe it's like, don't be a MMA person. No, I don't know. But like, no, but yeah, just, is there any of these like key things, like a certain tip or like a number one thing, like if you're doing this, you ought not to, or maybe you can take it the other way of one thing that everyone should be doing,
I'll rattle off a couple things if that's all right. Sleep more than 5 hours every night. Don't stay up all night. Don't do any drug habitually, like consistently. Take breaks. I think this is an international call, so I can't speak to other countries. In the last 50 years in the United States, big sugar won at PR marketing. Fat's good for you, sugar's bad for you. So is processed foods. Flip that in how you think about your diet. Your brain is fat. There's a strong argument that we grew up on the coast eating fish, and that fish oils and fats is largely how we evolved our brain. So it's going from being kind of horizontal to vertical as standards. So fat is super, super, super important. So don't cut out fats. You can reduce them, eat good fats, but don't cut out fats. That's a thing I think a lot of young people do incorrectly. And then I'm just now getting old enough to notice that it's the little things every day that compound over time. So if you notice something, whether it's anxiety or a cognitive slip or a knee pain, if you're young, it's real easy to walk that off. But over time, that knee pain can become a torn meniscus. Over time, that moderate social anxiety can become a significant concern. It's the little decisions we make every day that compound to chronic illness. And so paying attention, and as we talked about, being preventative, I think is a really important thing to do. As far as things to do, drink a ton of water. Engage in whatever makes you happy, things that are stimulating, reading books, talking to people, playing games. And lastly, stay open to new experience. And I know that sounds a little, new agey, but there was a really cool study that came out of Yale where they tracked people who were in their 90s who lived beyond 100. And among other things, they gave them it's called the Big 5 personality factors. And what they found was when people shifted down in openness, when people became less open to new experiences, to interactions, to information, as a group, they were dead within 2 years. Stay open to new experience. It's the same thing we tell people with cognitive issues: play games, play cards, socialize, engage, read books. stay open to new experiences always.
That's pretty incredible that factor kind of makes such a difference. Because then I think about, like when we talk about super centenarians and whatnot, and I wonder how that kind of correlates there with, the mindset that you're kind of taking on, about your life, about aging and all different sorts of other subjects, and how that literally affects your brain structure and health.
We're halfway through the data collection on a super centenarian MRI project, so I'll circle back with you when we have results.
Amazing. All right, and I guess maybe we can just end off with some futurism stuff. Someone asked, what's the most exciting thing about brain-machine interfaces like Neuralink? And I guess I'll extend that to say, what are the most promising kind of regenerative medicine, futuristic things that are going on right now?
Yeah, I mean, already with brain-machine interfaces, you can type, you can move around in a computer screen. I have a friend who runs a company with an EEG device in augmented or virtual reality. You could like levitate things and move around. I think either it exists or someone who with good programming skills just needs to make it exist, where you could throw on an EEG cap on your drive home, and that could be programmed so that, depending on your mood state, the lights are on a certain color, the music's playing a certain thing, the temperature is like a certain thing. That technology exists, and we're living in that world. I think it's super exciting. I think Neuralink, I think it's a really interesting concept, and I think they'll be able to do a lot of the things they want. I see their use cases being very limited because I'm a pretty significant transhumanist. I'm a very early adopter of things, and you're not sticking an electrode into my brain. I like my brain; it works pretty good.
I'm with you there.
Right. So I think for people who need that, I mean, putting electrodes in people's brains happens all the time. Parkinson's disease is a good example, and it's very effective. So I'm not downplaying it, but I think for the broader community, it's non-invasive brain-computer interfaces, EEGs, focused ultrasound, some of these things that you can just throw on and throw off. And I think already we can do things like what we're doing with our phones to make our kind of life a little bit easier. But I foresee a future where we can predict things like changes in brain health, changes in cognitive function. I can certainly imagine a future, all it would take is somebody wanting to build this, where I throw a cap on in the morning and it tells me I slept poorly because it pulled that information from my wherever you use, and says, and your this part of your brain's not working as well today, so your attention's poor, so you should shift how you're going to do your day, right? Or so we're going to pull up your calendar and help you out. I think there's all sorts of kind of day-to-day things that brain-computer interfaces can allow us to do, especially if you combine them with augmented reality. You can also imagine a world where, to use ultrasound as an example, so you can put energy almost anywhere in the brain with ultrasound, non-invasively, and you can and people are doing similar things with magnetism and electricity. Although you're limited to what part of the brain you can put those energies, but you can imagine wearing an EEG cap, putting energy into the brain. And then rather than assuming that all of our brains are the same, so we should put energy in the same place, it's closed loop. So the EEG reads your brain, you put energy in, the EEG reads it, tells the energy to be a little different. And you have this kind of iterative closed loop system where you're shifting your brain into the desired state in a very personalized fashion. So I think, that future is right here. I think it's going to be really exciting. The one other thing I would say is there's a study in Nature in like 2017 where they took exosomes out of a part of the brain in old rats and put them into young rats. And those young rats aged really quickly. They had less sex, their hair got darker, they got motorically slower. Okay, interesting. Does the opposite work? If I take those exosomes out of the same part of the brain of a young rat and put them into that part of the brain of an old rat, do they get younger? And the answer is yes. Their hair gets lighter, they move more, and they have more sex. So there's this idea that you could use ultrasound targeted that part of the brain to deliver exosomes there in humans to try to reverse or slow the biological clock. Does that work? I have no idea. Is it a possibility? Absolutely. A lot of stuff works in mice that works in humans. Also, a lot of stuff works in mice that doesn't work in humans. So we'll see. But this idea of taking some kind of non-invasive technology for the brain, some kind of regenerative medicine, and then in the future, maybe in a closed loop fashion, making it personalized for the individual. I think that's one of an infinite number of ways we're going to get real good at living real long, especially living long well. I think I'm newer to the space, but I think the phrase is health span. I don't want to be 150 and feel like 150. I'd love to be 150 and feel like 36 has been pretty good. So that health span, I think we're going to get better at living longer in a healthy way.
Yeah, that's definitely a future that, you know, we're all looking forward to, and, you know, we just have to, you know, keep on going and make it there. But as you said, some of it's already kind of here, and it's just more about the application and probably a little bit of funding and all that kind of stuff as well. And the more sort of these efforts kind of pop up to connect these dots and these minds and ideas, the better that the faster we can actually make them a reality. So.
Absolutely. Grateful to be along for the ride.
Taylor, we got to wrap up now. We've hit the hour mark. Thank you so much for joining us today. I feel like this was very insightful, and not that I left with more questions, but now I have more questions of being like, oh my gosh, okay, well, this is so interesting. I didn't know that. So I appreciate your time, and hopefully we'll get another, I guess, roundtable kind of on more of this, because we really just scraped the surface, I feel like.
Absolutely. Thank you for having me, and I'll come back anytime. Have a great day, everybody.
Awesome. Thanks.
Cheers.